If you're watching this, there's a good chance someone you love is in the hospital right now and you're being told they're medically stable. But you're not sure they're safe. Maybe rehab wasn't approved. Maybe dementia has progressed. Maybe there have been repeated falls. And now you're asking, when is memory care actually the right next step? I'm John with Oasis Senior Advisors, Austin and Central Texas. And we've been walking alongside families in Austin, Kyle, Georgetown, Waco, Temple, New Braunfels, and across Central Texas for 10 years during moments just like this. Let's talk through this calmly. Why rehab sometimes isn't approved. Medicare and many Medicare Advantage plans require something called restorative potential. That means the patient has to be able to actively participate in therapy and show measurable improvement. If someone has advancing dementia and can't consistently follow instructions or participate in therapy sessions, skilled nursing or inpatient rehab may not be approved. That's not about fault. It's about clinical criteria. And when rehab isn't approved, families often have 24 to 72 hours to make a decision. The question most families ask. The next question is usually, can we just take them home and see how it goes? Sometimes that works. But in many cases across Central Texas, what we see is, they go home. Confusion increases. Another fall happens. Another ER visit follows. That revolving door is exhausting, physically, emotionally, and financially. So the real question becomes, is home truly safe anymore? When memory care becomes the safer option. Memory care is not about giving up. It's about safety and stabilization. It may be the right next step after a hospital stay if there's significant wandering risk, repeated falls have occurred, medication management has become inconsistent, confusion is increasing, the caregiver at home is overwhelmed. Memory care provides a secure environment, 24/7 dementia-trained staff, structured routines, medication oversight, fall prevention support. For many families, it becomes the turning point toward stability. What the hospital-to-memory care process actually involves. If memory care is being considered, here's what typically happens in Texas. First, the right setting must be identified. Not all memory care environments are the same. Some are smaller residential care homes. Others are larger memory care neighborhoods with structured programming. The right choice depends on cognitive stage, mobility, behavior, and medical needs. Second, required documentation must be aligned. This usually includes a current physician's report, medication orders, and TB screening. Most discharge delays happen because paperwork isn't fully aligned, not because anyone did something wrong. Third, any ongoing medical services, such as wound care, visiting physician services, therapy, or hospice, should be coordinated before move-in, so support begins immediately. When done properly, this transition can happen smoothly and quickly. Transitional changes. After the move. This is important. It is common for seniors with dementia to experience temporary changes during the first few weeks after a move. You might see increased confusion, disrupted sleep, heightened anxiety, sometimes referred to as relocation stress. This is usually temporary. Experienced dementia care teams across Austin, Kyle, Georgetown, Waco, Temple, San Marcos, and New Braunfels understand this adjustment period and work intentionally to stabilize routines. Knowing this ahead of time helps families stay calm. Financial considerations. Memory care is typically funded through private resources, long-term care insurance, veterans benefits such as aid and attendance. Every family's financial picture is different. Clear planning early helps prevent discharge delays. The bigger picture. Senior care decisions are some of the most complex and costly choices a family will ever make. Experienced local guidance changes the outcome. If you are facing this decision in Central Texas, know this: you do not have to figure it out alone. If your loved one is in the hospital right now and you're unsure whether home is safe, start by asking the right questions. Safety, stability, support. Those matter more than labels. I'm John with Oasis Senior Advisors, Austin and Central Texas. We've been helping families across Central Texas for 10 years navigate hospital discharge and memory care decisions. Take a breath, then take the next step thoughtfully.